So hi, my name is Darren Foskett. I'm the General Manager for the ED department, the emergency department here at Lewisham, and for the Chestnut Award. Today I just want to introduce myself and why we're here today, which is to talk about the Harbour Cafe. Lewisham and Greenwich Trust and South London and Maudsley made an application for capital funds at the end of last year, and we were successful. And that's allowed us to develop a part of the old nursery into what we're calling the Harbour Cafe. The purpose of the cafe is to deliver mental health support for patients that are unlikely to be admitted into a ward but need some holistic support with the aid of South London Maudsley and an agency called Solidarity in Crisis, whose target will be to support and help these people into returning to their lives and to be able to manage their crisis.
I'm Aidan Collins. I'm the Clinical Service Lead for Lewisham Home Treatment Team and Psych Liaison Team. I work for South London and Maudsley NHS Foundation Trust. Before the Harbour Cafe, there was very few resources for people experiencing mental health crisis in the community in Lewisham after 5 o'clock. There was the crisis line, which is managed by SLAM, and also attending A&E. We are aware of the impact that that can have on people, especially waiting around, and obviously the environment. So we are aware that that is not the right area for people to be waiting whilst they're experiencing a mental health crisis. The opportunity for the Harbour Cafe is for a place where people can attend a calm, neutral and safe environment so that they can take control and manage and empower themselves around their mental health crises.
Hello, I'm Moyo Adofo and I work for Certitude as the Solidarity in a Crisis Manager. We're really excited to be delivering the Harbour Cafe, which is for people in a crisis, and really it's about people having a therapeutic space to come to at a difficult time when they feel unable to cope. And part of what we're going to be doing at the Harbour is a range of activities, groups and one-to-ones, arts and crafts, mindfulness, gardening, really just whatever the person's interest may be. And also what we have as well, we know that sometimes things, because of what's going on for people, they might need some quiet time. Also, we will have a sensory room for people to come to have a quiet space for themselves to reflect as well. We're also going to be offering one-to-one sessions for people with a peer support worker, and it's just around providing emotional support that's non-judgmental, based on empathy, for the person to have a space to talk about what's going on for them.
So, taking my experience of accompanying my loved one to A&E, being able to bring them to a place like this, where we can help them to bring their anxiety levels down, where they can find other things to do, where they are not among strangers milling around, and so on. I think if it works, it'll be fantastic.
So yeah, this has also been my experience in supporting my loved one in an A&E environment. I'm excited to hear that they've got activities here that can support my loved one and support the patient, so that way their crisis levels, even though they're already perhaps in a mental health crisis, doesn't escalate. And I feel that they can use many activities here, like the computer, or at least have a cup of tea, or use anything like musical instruments if they wish, or any other activities. And I feel it's important. Anything that helps the patient can also help family and carer.
Yeah, is that anxiety, isn't it? The carers get anxious, the patient gets anxious. So anything that will bring it down, great. It's a win-win.
The Harbour Cafe is being managed by Certitude with clinical support from SLAM, and that is from experienced clinicians. And at the moment, the referral process is by a triage form from a SLAM clinician or other community mental health teams and agencies associated with SLAM, so that they fill out a form which is quite basic and they just put information in. But what is most important is the referral observation zone. So it's RAG rated, red, amber and green, and it gives people the opportunity to assess what is appropriate for the service, so that the right person enters the place so they can get the maximum opportunity to empower themselves and recover from their mental health crisis.